Good morning, teachers and friends. Today, we'll be talking about asthma. Did you know that 1 in 5 children in Singapore are suffering from asthma? With this level of prevalence, it is definitely essential for us to get an in-depth knowledge on this matter. So, what is asthma? Asthma is a condition in the lungs that cause intermittent symptoms. It could be the swelling or inflammation of the airway lining, excess production of mucus that is thicker than normal, or muscle contractions around the airways that cause it to be narrower. So now let's learn about asthma in the Singapore context. The prevalence of asthma in Singapore is 5% in adults and 20% in children. Asthma mortality in the Singapore population has fallen from 7 per million in 1998 to 2 per million in 2010. According to the Global Initiative for Asthma's Global Burden of Disease report, out of all the asthma patients admitted into the ICU, 67% had untreated asthma. Singapore is a high-risk country for asthma deaths. Of course, none of them were using preventative medication. The most common symptoms of asthma are wheezing, breathlessness, a tight chest, coughing, or increased heartbeat. Many other conditions can also cause these symptoms, but they are more likely to be asthma if they often reappear, if they are usually worse at night and in the morning, or if they happen in response to asthma triggers. Patients develop symptoms in response to certain asthma triggers. Such asthma triggers include infections like the common flu, allergies against pollen, dust mites, animal fur, etc., hormonal fluctuations, a change in the weather like a change in humidity, exercising, emotional distress, tobacco smoke, or air pollution. Smoking does not cause adult onset asthma, but exposure to smoke can provoke an asthma attack. Asthma can also be a result of genetic factors. For example, a study in 2006 discovered the association of at least 100 genes with asthma. By looking at the diagram, we can see that asthma can be initiated at any point in your life, whether you're a child or an adult. Asthma often begins in childhood. Children diagnosed with asthma may find these symptoms to diminish or disappear during puberty, which is indicated by the green curve in the graph. This might be because the condition is very mild. However, there are chances that it may occur in life as shown by the sine curve in the graph. This may be because the disease is in a dormant state or the patient persists on a poor lifestyle. Some people will experience asthma throughout their lifetime, as shown by the blue curve. In this case, genetics could be a major factor. However, bad lifestyle choices and diseases that cause lung impairments could also cause asthma to persist in individuals. Although many people first develop asthma during childhood, asthma symptoms can also occur at any point in their life, as shown by the red curve on the graph. This might be because they have been consistently exposed to smoke or irritants. Adults who develop asthma later in life are said to have adult onset asthma, and adults diagnosed with asthma have persistent symptoms, unlike childhood asthma, in which children only have intermittent symptoms in response to allergic triggers and respiratory infections. A study shows that the mean age of onset of asthma for children is 7 and for adults is 38. When allergens like pollen, wood dust, animal fur, etc. enter the lungs, it can trigger an inflammatory response. This asthma-causing inflammatory response is also called type 2 inflammation, and about 50 to 70% of asthma patients have this inflammation as the main cause of their asthma. During a type 2 inflammation response, dendritic cells engulf the allergens and display the antigen fragment complex with class II MHC molecules on the cell surface. Naive T helper cells bind to the class II MHC antigen fragment complex in antigen-presenting dendritic cells via its antigen receptors and CD4 co-receptors. Binding of naive T helper cells will result in signal exchange in the form of cytokines, which results in the activation of naive helper T cells. It will then release interleukin-4, which drives the differentiation of the naive T helper cells to Th2 cells or T helper 2 cells. Th2 cells will continue to release more interleukin-4 while also releasing interleukin-5 and interleukin-13. Interleukin-13 will result in 4 impacts. Firstly, Thicker white mucus will be secreted on the endothelial lining of the bronchi as a result of goblet cell hyperplasia. Secondly, the epithelial cell barrier is disrupted, and upon healing, collagen deposition occurs. This changes the shape of the airway as the collagen composition is altered. Thirdly, smooth muscles of the airways thicken, which causes the constriction of the airways. Fourthly, nasal polyps will form, which are small tissue growths in the nose. They will make breathing more difficult. This results in airway hyperresponsiveness, which is the exaggerated response of the airways that lead to the obstruction of the airways. And therefore, we'll observe the classic symptoms of asthma, which are tight chest and breathlessness. Interleukins 4 and 13 will also cause B cell class switching to produce IgE, and this leads to allergic inflammation due to the recruitment of mast cells and basophils. Mast cells release histamine, which causes vasodilation and an increase in capillary permeability, allowing blood plasma to accumulate in local tissues. This causes further swelling of the bronchi. Interleukin 5 will mediate the differentiation of eosinophils in the bone marrow. Lastly, interleukins 4, 5, and 13 will mediate chemotaxis of eosinophils to the inflamed lung tissue and hence promotes tissue eosinophilia. Contraction and relaxation of smooth muscles in the airways is controlled by the nervous system. While the sympathetic nervous system causes airway dilation during a fight or flight response, the parasympathetic nervous system controls airway constriction. Recent research shows that asthma patients have a hyperactive parasympathetic nervous system. In asthma patients, parasympathetic nerves fire more signals, which results in the constriction of smooth muscles it is connected to. Bronchial airways are mostly innervated by the parasympathetic system, while there are few direct sympathetic nerve connections. Sympathetic nerves stimulate the adrenal medulla to release adrenaline, which dilates the airways. However, this is a slow, indirect signal. Asthma cannot be cured, but its symptoms can be managed. So far, inhalers are the most effective way of getting life-saving medication to people with asthma. Anti-inflammatory asthma inhalers prevent asthma attacks and reduce swelling and mucus in your airways. They include steroids like cislesonide, fluticasone propionate, budesonide, etc., which act as beta agonists, targeting the beta receptors on smooth muscle. Here is the structure of some steroids that are used in inhalers. These steroids bind to beta receptors which trigger a sympathetic response. This results in the relaxation of the airway smooth muscle, hence dilating the airway. As these receptors are abundant in the lungs, the use of inhalers is effective and has immediate results. However, there are some possible side effects that come with inhalers. When withdrawing from inhalers, the reduction of corticosteroid intake from the inhaler might aggravate the asthma, and the inhaler dose will need to be increased. Inhaling corticosteroids also come with side effects such as dry mouth, coughing, tiredness, mood swings, adrenal suppression, and it can also possibly cause damage to the hippocampus. Research shows that children with asthma who use inhalers experience a higher incidence of depression. Corticosteroids also deplete vitamin C and D and some essential minerals in our bodies like calcium, zinc, and potassium. Asthma can also be controlled with proper lifestyle changes as well as medications. The medicine used to treat asthma includes relievers and preventers. Relievers are medications that provide rapid relief of asthma symptoms when an asthma attack occurs. A possible usage of relievers would be before exercise, such that there is a minimal risk of exercise-induced bronchoconstriction. Preventers are medications that are for use every day. They help to control asthma such that symptoms are rare and asthma attacks are even more rare. The most commonly used preventers are inhaled corticosteroids. The inhaled corticosteroids are often paired with drugs such as long-acting anticholinergics. These anticholinergics relax and dilate the airways in the lungs, allowing greater ease for breathing. A study of 2,700 asthma patients has found that nearly 40% of individuals are only using a reliever to alleviate their symptoms and are not actively treating their underlying cause with medication.